I want to move now to our next speaker. I have the honor of introducing a real doctor. She's an MD, medical doctor, Nada Fadul. She works at the University of Nebraska, and they have started a center of excellence around the ECHO project that started here at the University of New Mexico. And we have teamed up, we meaning Peace Engineering has teamed up with them to launch the Peace Engineering ECHO Center of Excellence in Sudan. I want to say that all our thoughts, prayers are with the people of Sudan. It's tough times right now. And I think we have to take that challenge to move forward. And Nada, please, microphone is yours.
Thank you so much, Ramiro. Thank you, everyone. And I'm really grateful to the prior speakers because they laid the foundation really well for what I was going to say today. Initially, when I got invited to do this presentation, I was pretty excited about presenting to you something that we could be launching pretty soon, but due to the events in Sudan, a lot of this work is now unfortunately on hold. But I would also like to take this opportunity to direct that energy towards a new direction. And the way I'm thinking about this is do not let a good crisis go to waste. And I think now we have a crisis that created an opportunity to put really some of this energy into a different framework and use it to implement real, tangible, peaceful outcomes on the ground in Sudan. So like Ramiro said, we started some work in Sudan, and I'm going to go ahead and just go and present a mode. I'm having some internet instability, so I'll turn my video off while I'm presenting. So our program was called the Sustainable Development and Response ECHO Center of Excellence. So I serve as the Assistant Dean of Diversity, Equity, Inclusion, but my main role is actually I'm an Associate Professor of Infectious Diseases at the University of Nebraska Medical Center. And my work was focused initially mostly on HIV, and that's how I came to be interested in equity, inclusion, and justice and diversity. But obviously with COVID, all infectious disease efforts and energy has to be directed towards a new direction. And with COVID, we now found even greater deal of inequities and disparities. So that actually brought things to the surface and made this work really even more relevant. So I'm from Sudan. And for most of you who know where Sudan is a beautiful country that's located in a very strategic location. It's a bridge between the Middle East and the rest of Africa. It's bordered by the Red Sea, Egypt, and many African countries. Unfortunately, in 2011, Sudan was split into Sudan and South Sudan because of a long ongoing civil war that has been going on for decades, and because of a military dictatorship regime that was not really inclusive. So that led, unfortunately, to the country's fracture. Sudan is also housed to over 70 pyramids, and many people don't actually think of pyramids when they think of Sudan. They think of Egypt, but we have one of the most ancient civilizations on the face of the earth. And it's just a beautiful site. I was there in 2019. It's just really breathtaking. So hopefully when we get to stability again, some of you can visit Sudan. This is where the Blue Nile that comes from Lake Tana in Ethiopia meets with the White Nile that comes from Lake Victoria in Uganda, and they form the Great Nile here in Khartoum. So it's, again, a breathtaking site. The Red Sea is very rich in its resources. We have every single resource that you can think of. Sudan is very rich in agriculture, in livestock, in gold, in oil, in other minerals. Is just an amazing, rich continent. But unfortunately, because of corruption and dictatorship, Sudan has never been able to leverage those resources. So there was an ongoing genocide in Darfur that went on for decades, killing over 300,000 people and just completely destroying the country. And finally, in 2019, the people of Sudan said, it's enough. We cannot live with this anymore. There was a massive revolution that erupted starting in December 2018 and got the world's attention. The world was finally paying attention to Sudan and looking at the Sudanese in a different lens, because women and youth were actually leading this revolution. This is a breathtaking image that's just, whenever I look at it, I'm just completely captivated. This is a train that traveled from northern Sudan from a city called Adbara, which is kind of the hallmark of railroad in Sudan, of leading that system. And people came on this train, and as you can see, some of them were actually riding on top of the train, in front of the train. And people in Khartoum met them with a lot of warmth. They joined the sit-in that was taking place in the army headquarters. And few days after that, actually, the dictatorship ended and al-Bashir was taken to prison. This culminated into transitional government in August 19. It was a hybrid of civilian and military, and appointed Prime Minister Hamdok to lead the country through this transition. We all got excited now that we have a transitional government, and our hopes for democracy were finally coming to fruition. We started the building process. So this photo here says Hanabniho, which in Arabic translates is we're gonna build it. And all people from inside and outside Sudan came together towards rebuilding of the country. And as you all know, COVID started right after that. So transitional government started in 2019 and COVID hit in March of 2020. So a lot of the rebuilding efforts, of course, were framed around sustainable development goals. We wanted Sudan to catch up. We were quite behind because we never really got the chance to start rebuilding before August of 2019. So we wanted to quickly catch up and, kind of join the crowd, so to speak. So I've been really active with Sudan for the past decade, mostly with Sudanese Americans here in the US through several organizations. But during the revolution, I started working aggressively towards advocating and bringing light to the brutalities that were happening in Sudan and the injustice that was happening there. So I joined a lot of advocacy efforts. And when COVID hit Sudan, we came together and we formed what was called the Coalition of Sudanese Organizations Against COVID-19. The idea actually came from an organization called ASAPA, which is Association of Sudanese American Professors in America. And we wanted to join efforts with other organizations so that we can help the fractured healthcare system in Sudan make it through the COVID pandemic, because we really didn't have any public health infrastructure. So about 62 organizations, some of them are community-based organizations, some of them are professional organizations, came from all over the world. We had members from Australia, New Zealand, Ireland, UK, the Gulf region, the US, of course, Canada. They all put their efforts together, and we did massive fundraising to help build some of the infrastructure in the country, including oxygen networks in hospitals, oxygen tanks and plants around the region, providing some kind of innovative solutions that were developed here in the US and translating them into something that could be implemented locally. So an example of that was UV light decontamination of N95 masks. This technology was developed at University of Nebraska and was implemented first here, and then we took it immediately and implemented it around Sudan's, even in remote regions around the country. So when the second wave of COVID hit, we really needed to work at the community level because there was a lot of lost opportunities. There were students, health professional students who were staying home because schools were closed, and that was a massive human resource that we wanted to take advantage of. So we established something called the Community Medical Response Team. Myself and my friend, Dr. Reem Amara from Emory University came together, put together a curriculum, got it approved by the Ministry of Health, and recruited students, start training them on how to combat COVID at the community level. So the program started mainly in Khartoum. We started with a group of 20 students, and we trained them to be trainers as well as leaders of this effort on the ground. And the program really quickly expanded because a lot of the students had their own networks, and they started calling their friends and telling them about this work that you could do in your own neighborhood to combat COVID-19, and that we have connections with the Ministry of Health to facilitate this work, as well as external outside entities. And Sudan, for the past 30 years, was deprived from that knowledge exchange with the outside world because it was placed on the US state sponsors of terrorism. It was under sanctions that massively affected not just the economy, but also the academic system in the country. The program now operates in 5 different states around the country, and we were actually getting ready to establish a program in Niala, which is southern Darfur, one of the regions that was affected by that genocide. So we were using the ECHO model to exchange knowledge. And for those of you who are familiar with the ECHO model, the motto of that model is moving knowledge, not people, which is really fascinating and fitted really well with what we were trying to do. Because we had subject matter experts in the US, but also around the globe and in Sudan itself. But those subject matter experts were not able to reach people in remote area. So we wanted to move that knowledge through our CMRT team, the ECHO participants, so that knowledge could reach even the villages in some areas of Sudan. So we felt the ECHO model is really fitting to what we were trying to do. And I would really encourage you to visit the Project ECHO website in the University of New Mexico to see how that's making change around the globe. So we had 2 ECHOs going on, started in May 2021, and by now we had about 11 ECHOs for the facilitators and 11 what we call general ECHOs. So the facilitators are our trainers. These are our kind of boots on the ground who are overseeing the teams, kind of giving them direction and training new teams as they come on board. We brought subject matter experts from the US, from University of Nebraska, from the Federal Ministry of Health to meet with these facilitators twice a week, as well as meet with the general ECHO team, all of the team, as well twice a month, not twice a week. So then the other team that we had was the implementers team. And this is a team that was actually taking that knowledge from subject matter experts and implementing that in their own neighborhood. And I'm going to give you some examples of that so you can see how that translated. So some of the efforts that they did was remote home care for patients who are not candidate for hospitalization. And as you know, 85% of COVID-19 patients do not need to go to the hospital. But if they left in the community unattended, they will spread that disease because they need to be instructed on how to effectively home isolate with minimal resources. We also had vaccine awareness campaigns. We visited local mosques, worship places. We had a very active social media campaign as well as a mobile vaccine clinic. I'm going to go quickly through those because I know we're behind on time, but this is a team in a very remote village in middle of Sudan, very rural area, had a lot of COVID stigma. So the team decided to start with the schools. They visited elementary and middle schools and educated them on COVID-19, hoping that those students will take this knowledge and take it to their family. And actually that made an impact because the students, the pupils, so to speak, were really buying into this. Another team helped organize a vaccine clinic in another town in Sudan. They were visiting local healthcare centers, visiting homes, talking to people actively in the market, finding any opportunity to put a booth in any expo and talk to people about COVID and COVID vaccination. We had several vaccine clinics. As of last week, we had vaccinated almost 3,000 people in different regions of Sudan. They will take opportunities for women gatherings and go there and start answering questions about COVID-19. This was a youth conference. Again, they had an expo there and they had a vaccine clinic going at the same time. So our collaboration with Peace Engineering came from the fact that we had a real hard time with the idea of spreading knowledge to remote areas because, as you can imagine, in Africa, we have a big problem with telecommunication. So I felt that at the time when we were trying to address inequities, we're actually creating inequities because those students in remote areas of Western Sudan and far North Sudan had problems with joining us on Zoom and different different communication platforms. So we had to solve that problem. We had a lot of infrastructure issues, whether it's power, whether it's telecommunication, and we cannot really create health in the community without addressing the infrastructure issues. I mean, Ramiro always reminds us of WET, water, electricity, and technology, and we need to address those issues in order for us to achieve healthy communities. So establish this strong bond and collaboration. We had several meetings where we kind of went through how peace engineering can help us address these inequities, but that actually led to the idea of establishing a peace engineering ECHO program in Sudan to address some of the issues that we were finding on the ground through a similar model to the CMRT. And the name that was chosen for that by the engineering team was CERT, the Community Engineering Response Team. So we had several ECHOs going on at the time. Some of them were already up and going. Some of them were in the ideation phase. The UNMC CMRT program that I already described, the SAMA, Sudanese American Medical Association program, they also started a program training healthcare workers on the front line on how to address emergencies. The Federal Ministry of Health had a few programs that they were planning to launch the beginning of next year. And as I mentioned, the peace engineering team had the CERT ECHO. The first program that was supposed to be launched was in Niala, Western Sudan, and the program was supposed to address refugee resettlement, refugees and IDPs resettlement in the region, and building a collaborative model where refugees, engineering students, faculty, all come together to address those issues of resettlement. We were framing everything around the Sustainable Development Goals. So all of these echoes, we assigned several SDGs to them. And we were building the program to address those issues. However, unfortunately, on Sunday, the military took over power in Sudan. And that was a devastating event to us because now we're completely disconnected from our boots on the ground. We don't even know if they're safe. I was almost in tears when I saw Taqwa in the chat room here earlier today, because at least I know now she's safe. But the situation on the ground is devastating. So I'm trying not to be emotional here, but it's really hard to, because the past few days have been very tough. So we've been kind of directing our efforts now to how we can help people on the ground through advocacy, donations, raising awareness. It's really disheartening that some people are calling this. It's not a military coup, but it's an attempt at correction. And attempts at corrections are not going to come with violence. There is military tanks on the street right now shooting protesters, peaceful protesters who are standing there asking for the right for freedom, peace, and justice, and there are military tanks shooting them. The videos that come from Sudan are absolutely horrifying, and the military is now calling this an attempt at correction of path of the transitional government, which is just unfathomable. So how can we help? We can raise awareness. There are a lot of Twitter accounts that are actively kind of bringing to light what's happening on the ground to Sudan. Some of them are in English, and I listed those here. So I'd really invite all of you to go and visit those Twitter accounts, follow them, retweet those messages so we can get the message out to the world. For those of you who live close to Washington, D.C., I'm going to be there on Saturday for a solidarity protest to raise awareness to what's happening in Sudan. We've invited several organizations and media agencies to come and join the protest. We've been actively advocating to U.S. Congress, Foreign Relations Committee, to take immediate action against the military coup in Sudan. Now, all of this led me to think that, we have such a beautiful model of grassroots work, started with the medical team and then came to an engineering team, and we had a leadership and agile echo in the process as a collaboration between Conscious Coalition and Sudan Next Gen. And this was a beautiful model of interdisciplinary partnership. So I think this is what I'm doing here is a call to action. I think we cannot really achieve sustainability without peace. So we need to direct these efforts towards a peace first echo. And our hope is that we reach a degree of stability that will establish that in Sudan. And the theme of this peace first should be around JEDI, justice, equity, diversity, and inclusion. We need to create communities that can live together and have peaceful coexistence. What happened in Ethiopia and Sudan is a very vivid example of how we cannot achieve sustainability without achieving peace first. We would be lying to ourselves if we say we can bring these communities that have been living in conflict for decades and now have them go and build without creating that peace first. In order to do this, we have to break these silos. All of us professionals and academicians, we live in our own little silos, and we have to break those silos. Engineers, physicians, social scientists, all of us, we need to come together. And today, this conference has a beautiful collection of all of those. So we need to put our, foot to the ground and start working on breaking those silos and creating this interdisciplinary partnership and work from the grassroots. There's so many beautiful grassroots efforts that are happening that they just need to be kind of directed to the right place. And there is an opportunity for knowledge and practice exchange. There are things that have worked in some places in Africa and other regions in the world, and we could exchange those practices and customize them to the local culture and needs of those communities. And we need to focus on tangible short outcomes. And this is where Agile can come to place, because if we achieve those short-term tangible outcomes, we can achieve long-term outcomes. So I'll end here, and I'm happy to take any questions later, because I know we're running out of time. And thank you so much for the opportunity.
Thank you, Nada. Thank you. Our plan was different to show what we've been doing in Sudan, to working with them, but now that got cut off on the 25th, and now we're in a holding pattern. Thank you so much. We'll have questions later for you.